In addition to something called endometriosis, PCOS, or Polycystic Ovary Syndrome, is something, a reproductive condition that so many women experience, but it often goes undiagnosed because it can be a little bit tricky to diagnose it, but often also because a lot of care providers just brush it off and tell the woman, oh, you're just having, difficult menstrual cycles. That's normal. Don't worry about it. And a woman's like, well, this really hurts. I'm having a lot of really uncomfortable symptoms. I would like some additional help. And they're just continually brushed off. Obviously not all the time, but again, that's one of the common reasons why it goes undiagnosed. Okay, so what is it? So PCOS, it is a metabolic disorder that results from an imbalance of reproductive hormones. And again, it impacts millions of women, and it can result in a range of uncomfortable symptoms, one of which is infertility. It's actually one of the leading causes of infertility. But luckily, with the right support, there are ways to manage the symptoms and to receive treatment that can help result in a healthy pregnancy. Okay, so looking out for the symptoms of PCOS and receiving treatment is important for your fertility, but also because PCOS is sometimes linked to diabetes, anxiety and depression, heart disease, uterine cancer, and obesity. So it's really important for your overall health to receive treatment and a proper diagnosis. Okay, so if you're having irregular periods, that could be a sign of PCOS. What does irregular periods mean? It means that maybe some months your cycle is 35 days, and the next month it's 21 days, and then the next month 28. Or maybe some months you don't have a menstrual cycle at all, or you have an exceptionally heavy one and then a light one the next. So anything that is, again, irregular, ovarian cysts, which obviously that's something that you wouldn't know you had unless a doctor usually looks via ultrasound. That's how most ovarian cysts are diagnosed. Difficulty conceiving, having high levels of androgens and insulin, which is something that can be tested for through a blood test. If you have adult acne, weight gain that is kind of hard to explain, say you're sticking with your regular diet, but you just suddenly start gaining a lot of weight. If you start growing excessive facial hair, if you have high blood pressure or elevated cholesterol. And this, again, it can be tricky to diagnose without the care of a specialist. And by this, I mean a fertility specialist. So I would make the first stop your obstetrician and talk to them about it, ask them if they can give you, order a blood test, ultrasound to see if, you have, say, elevated androgens, for example, to see if you have those cysts, if they kind of brush you off, or if they're like, I don't feel like I'm equipped to support you in determining if you have PCOS, then your next stop can be a fertility specialist because they are well trained in helping women spot conditions like PCOS and know how to guide them through it. So treatment for PCOS typically involves a few different options. So one of the first things that most doctors recommend is weight loss, because even losing just 5% of body weight can really help to minimize PCOS symptoms. And then if a woman is not trying to conceive, hormonal birth control pills can really help. All of the symptoms, but especially things like acne, excessive body hair, and the irregularity in the menstrual cycles. So if a woman is trying to become pregnant, one of the first things that a fertility specialist would do is prescribe ovulation induction medication. And this can help the woman overcome the ovulation issues that PCOS causes. This is one of the primary ways that PCOS impacts fertility, is by potentially making it really difficult for the woman to ovulate. If that doesn't work, they might then recommend something more extensive like IVF or in vitro fertilization. And in vitro fertilization consists of the woman taking ovulation induction medications that cause multiple eggs to grow instead of just one, which is typically the case during, your regular menstrual cycle. During that time, they regularly monitor you with ultrasounds and blood tests to see how your reproductive hormones are responding and to see how the eggs are growing. And then when they determine that enough eggs are the ideal size, they have you take a shot that prepares the body to release the eggs. Then about 36 hours later, they go in with essentially like a needle and they extract the eggs, send the eggs to the lab. An embryologist then fertilizes the eggs with sperm from the woman's partner or a sperm donor. And then they can also, these days, actually test the genetic chromosomal health of the embryos using something called, or it's a process called PGT, or pre-implantation genetic testing. And then that allows the doctor to pretty much ensure that they then are transferring a healthy embryo back into the uterus. And then hopefully that results in a healthy pregnancy. Around the time where the transfer will take place, often they also recommend that the woman take progesterone supplementation, and this helps prepare the uterine lining to support the healthy implantation of the embryo. All right, so if you have any questions about PCOS or any other fertility conditions or anything about pregnancy, childbirth, or early motherhood, go ahead and let me know in the comments below.